everybody, and welcome to DSN Forum Brunch. My name is Amanda, and I'm a diabetes nurse in Medway in Kent. Vicky?
Yes, sorry, I wasn't concentrating. My name's Vicky. I have a diabetes specialist nurse background, and I work with the Eden team who are with us today.
And then we have Tamsin.
Hi, I'm Tamsin, and I'm a diabetes specialist nurse, team lead at the Royal State University Hospital.
And our special guests today, we have Laura Willcocks.
Morning,
Laura.
people. I'm Laura, part of the Eden team at Leicester Diabetes Centre, physiotherapist by background.
And Fiona.
Hi, I'm Fiona. I work with the Eden team, and I'm a practice nurse by background. And Laura is my boss lady.
Yeah, mine too.
Cool. So just while people are joining, we've got an icebreaker question. Just while we're waiting for people to join, we always have a random question, and each time we try and think of something even more random. So today the question is, if you could have an unlimited supply of one thing, what would it be? And I want to go to Vicky first, because I know she's got something ready up her sleeve. What was it, Vicky?
It's not that exciting though.
Oh, you let us down now.
But my Eden colleagues will know that I love to drink Yorkshire tea, and I take Yorkshire tea bags into the office specifically. So it would have to be Yorkshire tea, because I can't function without my tea.
Very good. Tamsin, have you got something?
I was just thinking about it, and I think I would probably have to say cheese, because
I'm not a cheese.
I absolutely love cheese, so that would be my thing.
Fiona, what's yours?
Yeah. So I immediately leapt to chocolate, because I'm a complete chocoholic, and yeah, can't imagine living without that. Although I have tried, and I was miserable.
Nice. What's your favourite chocolate?
Twirl. I'm a cheap chocolate. You know, I'm cheap to keep. I do love a twirl. You get a really good chocolate hit.
The orange twirls were a bit of a sensation, weren't they? And people were trying to get hold of them. But I thought they were a bit of a letdown, actually. They weren't orangey enough.
No, agreed. Straight.
Laura.
Well.
Laura, what's yours?
I could talk chocolate all day, actually. You stole mine, Fee, there as well. So chocolate and Diet Coke, which have already been stolen, are two of mine. But with a head full of cold at the minute, I probably would say tissues right now. Or energy or something like that. But yeah, chocolate would be mine as well, go to.
And mine's Diet Coke. I always have some Diet Coke all the time. I live on it. It's my, I don't drink water. I literally drink Diet Coke all day long.
Got this sponsored, shouldn't they?
Yeah, I should. So, Vicky, I believe you have some questions for our lovely team.
I do. So yeah, I joined the Eden team about 6-7 months ago now, but obviously Laura and Fee have been within Eden for far longer than that. So it was just to start off really, guys, for those people who maybe don't know what Eden is or what it stands or what it represents, would you like to tell us a little bit more about Eden?
Of course, thank you, Vicky. Yeah, I think I've been around for about 5 or maybe 6 years now, actually. End of 2015-16. I started on the day after Boxing Day, which was very random, and I was the only person pretty much in the building, and I wondered what I'd let myself in for. So Eden stands for Effective Diabetes Education now, which is a fairly random title. It sort of predates all of us, I think, but it came originally from some work that was done in Leicester around 2012-13 about transformation and around the Super 7 and the Necessary 9. So it was around a left shift of care from secondary into primary care, and the subsequent education and mentoring that would go with that to enable staff to have the knowledge and both the confidence in order to treat more complex patients that were coming out into primary care. So that was how it was born. It was part of a big project in Leicester that has been written up over the last 5 or 6 years, and there's a number of papers published around that as well. So that's where it came from. And I guess it started out fairly simple, and it probably doesn't bear much resemblance to that now, in that it was about sort of a couple of different modules around insulin, and as we will, I'm sure, go on to talk about, the world's changed fairly dramatically and fairly rapidly since then. So our job as educators is to try to provide education for healthcare staff at all levels, working in all sectors, that will improve patient outcomes ultimately for people that are living with diabetes, cardiovascular disease, long-term conditions, multimorbidity. That's our job, and I think we're pretty lucky that it's our passion as well.
Thank you. And I don't know, Fee, if you want to maybe tell us a little bit more about some of the specific modules that we have on offer, and then maybe we'll come back to Laura with some of the other roles that some of the team members have.
I've just realised that I'm blending with the chair with my stripes. But anyway, so as Laura said, we originally helped the shift into primary care and away from referring everyone into secondary care. So our modules were just, we did 2 whole days on insulin and how to start people on insulin, how to look after people on insulin, how to not refer people when they needed insulin and just deal with it yourselves. So yeah, over the last few years, it's migrated and developed into a whole different thing, thankfully. And we've got modules on pretty much any aspect of diabetes. And what we're trying to do, as Laura said, is include multimorbidities, long-term conditions, cardiovascular, renal, all of the whole package that comes along with diabetes, and not just concentrate just on diabetes, but give people a more rounded picture of what diabetes can involve, what we're trying to prevent, including all the complications and including preventing type 2 in the first place and cardiovascular disease. But so it's become, I guess it's snowballed would be the term, and it's got bigger, the team's got bigger, the spread of Eden has got bigger, so we're not just concentrating on Leicester, thankfully, for things like this. We used to travel all over the country, but now we can do Teams or Zoom. So our modules include renal modules, Care Me modules, 3 treatment targets, as you probably remember our little Happy Heart session. We do a very big session on that, which is a whole day, on majoring on blood pressure and lipids and then glycemic treatments. Injectable therapies is still a big part, but it includes GLP-1s a lot more. We do protected learning time presentations quite often. It's a very popular part of our work, is to go into anywhere that will have us and talk about newer therapies and newer guidelines. So what we pride ourselves on, stop me if I'm going on too much, Vicky. You've wound me up and now I'm carrying on. What we pride ourselves on is that it is up to date, it's relevant. We like to think that we know what people need to know because we're in that environment as well. So I'm probably the only primary care worker on the team, but we have people in primary care and secondary care who work clinically as well. And so we know what it's like out there, and we know what people need to know to do their job well and to pass all those benefits of knowledge onto the patient, to give the patients a better quality of life. And so that's what we try to include in any learning module that we create or deliver. We try and make it really relevant, really bang up to date. So we'll put in any new therapies that we've heard of that are coming, anything in the pipeline, any changes in guidelines. And we make sure that we design our modules and our learning packages so that we can easily update them all the time, because as you all know, diabetes just never stands still, does it? And so we're constantly trying to keep it up to date. And that's one of the things I think we're really proud of, is that it's not an outdated session that we made 2 years ago or 3 years ago, because that would have gone out the window now. In the last 6 months, you think of all the changes that have happened, and we just keep that up to date and keep it relevant. And we are aware as well that people don't have as much time as they perhaps once had. So the modules can be delivered in bite-sized chunks, or we record some of them so people can watch them in their own time, things like that. We've adapted, but probably talk more about that later, and I'll shut up for now.
And I think in addition to that as well, you know, any of you that have ever been lucky enough to go to Leicester Diabetes Centre, we're incredibly blessed with where we work. So as part of our team, we're surrounded by 2 of the top 10 world experts in diabetes in Melanie Davis, Kamlesh Kunti, Professor Pratik Chowdhury, Sam Sidhu, who's a world leading expert in GP. We've got a physical activity team, a biomedical research centre. So we're really lucky that we can pull from absolutely what's current, what's happening, and what's being sort of researched, almost like cutting edge sort of research that we can then bring to implementation as well. So I think that we are really lucky that we've got all of that.
Yeah,
Yeah, we're all very jealous.
I know, we yeah, really lucky. It's not like working in a hospital, I have to say. I've been in some grotty rooms through my many years in hospital work, and this is not one of them.
Yeah, I mean, it is something we possibly take for granted, isn't it, Laura? But that is such an amazing benefit. Well, I've
taped my windows up and I've taped my windows down and all of those things in terrible old buildings and stuff. So
yeah,
I think I don't
mean,
think we ever take for granted the experts that are around. I don't know if it'd be interesting, Vicky, what your thoughts are on that, having been around. I heard Pratik talking the other day actually to our chief exec who came around, and he was saying why here rather than London, and he said, well, in my trust there was me and one other person in London, and I could get a research study going, and in 6 months I might have recruited 1 participant. In 2 weeks here I'd got like my full 30 that I needed. It'd gone through ethics, it was implemented, it was ready to go, sort of thing. So I guess it's just about having that infrastructure, isn't it? And we are really lucky that we've got that.
Yeah, there's so many sort of teams that all feed into one another. So when I first started, I was like, whoa, there's so many different teams. What do all these people do? But they all sort of interconnect and work together. And that's probably why, obviously, you've got the resources and the results that we get, because we've got that access to those people and that expertise.
Yeah.
I think that's the bit about reputation, isn't it? I'm sure you'll ask another question in a minute, but just building on what Fee said and something that Amanda said, for me, knowledge you can get anywhere. And I think what the COVID pandemic has taught us is that there's just an abundance of learning out there, all free, coming at you, 100 emails a day sort of thing. And you can pick up knowledge anywhere. Whether it's any good is completely debatable, isn't it? And it depends on what style you like, but ultimately you are never going to be short of learning about diabetes and cardiovascular disease if you signed up to everything that came into your inbox. But I did a lot of research for a talk I was doing last year, and it's not just that offline learning that helps people to learn. And we've known this for a number of years because we've had mentoring underpinned through all of our programs, but it's actually how do people make sense of that learning? And for us, all of our programs, if you like, or I'd go as far as to call it our sort of USP, if you like, is that actually it's that practice, that confidence, that underpinning mentoring, that case studies, that peer support. And that's what gives people the confidence, because we've all done courses where we go, that was brilliant, great happy sheet, thank you. Folder on the shelf, back in the drive, wherever it goes. And then 3 months' time, as Fee said, you can be sitting in practice with an insulin start or a foot to look at, and you're like, what do I do? Where was that course? Where was that bit of information that I learned? So I think it is the combination of both that learning, but it's also how we build people's confidence in order for them to make the application to patients. And that's what drives us. I think we'll hopefully never lose sight of that.
Yeah. And that is so important. I guess what we try to do as a team and what we do quite naturally comes from our love of all things diabetes. I mean, we all have been hooked in by, we've got the diabetes bug, and we are all thriving on it, and we're all passionate about what we do, as is all of you here this morning, or you wouldn't be here on a Saturday morning. But we hope that that's infectious when we do our presentations or modules or study days or mentoring. We hope and we think that comes across in what we do and is infectious, that enthusiasm for the topic, and that's the human element of Eden. And that, I think that's one of the lovely parts of Eden, is that we are humans who are really passionate about what we're doing, and we feel it's worthwhile. It's helping people, not just healthcare professionals, but it's helping the patients as well. And that infectious kind of drive, if you like, around the subject. I'm just thinking of a GP that we had a few years ago, a lovely female GP from Leicester, Sonia, and she came to every single Eden course that we put on for a whole year. And she said, I just love it. I love it because you love it and you've made me love it. And I love diabetes now and I can't get enough. And she decided she's going to make that her thing. But she was just sponging it up. And I think that's the nice thing about when us Edeners present stuff, or, you know, hopefully that comes across and that's infectious and it gives people the passion to do their job. Kind of it changes the way they work because they're now excited about it and enthusiastic about it, rather than I don't really understand it. I'm not sure, am I doing this right, am I doing this wrong? But that confidence is built up because they want to learn more about it.
Definitely. Diabetes is very much a love-hate, isn't it? There's a lot of people that absolutely hate it, but I find those people that hate it, it's the confidence, because they don't have the confidence, they're scared of it and they don't want to touch it. But as soon as you give people that confidence, they love it. They absolutely love it.
Yeah.
So we've got quite a few questions come in. So I'll do the first one, and then Tamsin's got a couple that she's been sent. So do you find primary care are happy to start insulin, or is there an issue with available staff resources? You talked about teaching people insulin in primary care, and just a lot of people in different areas struggle getting primary care to start insulin. It always seems to go to the DSN. So how do you find that?
Yeah, so I'm glad you asked. It's so variable, and it's variable where we are on our patch as well as in the rest of the country when we do speak to people elsewhere in the country. So variable. Some areas, no, never going to touch that. Always the pathway is to refer to DSNs. We, you know, as we originated from trying to do this and trying to get primary care to initiate insulin, then I guess this is one of our basic principles, is that it can be done in primary care, providing people are given that confidence and given the support as they go along. And I think people need to feel supported. We're not just standing with a PowerPoint saying, start on 10 units, Humulin I, you know, off you go, it's dead easy. We're there to continue to support people until they're confident enough that they're selecting the right people to start on insulin, and you know, then that they absolutely are aware of the choices. Am I selecting the right insulin? Is this not just, is this the right person? Is this the right time? And it takes time to build that confidence. You can't just say, here's a PowerPoint, this is what you do, off you go. And I think we have been able to offer that mentoring support along the way and just say, we're here. You know, we originally, before COVID, could come to the clinic and sit with you. You know, you can watch me do this insulin start first, and then, you know, I'll come and watch you do the next one, or I'll, you know, however you want to do it. Obviously now we're doing a lot of mentoring via this, you know, via MS Teams, and it's not quite the same, but hopefully, you know, we're still there to support with their questions. They can still tell us how they're getting on, and, you know, I'm considering starting this person, what do you think? So I think, yes, it's definitely possible. And once people have done it a few times, yeah, they're off there and they're absolutely fine. And it's just that it is scary. You remember what it was like. Yeah, it's scary. And it's all on your shoulders, especially as a practice nurse. You're very, you know, you've got that autonomy that this is on me. What am I doing? But, you know, once you get used to it and you've done it a few times and you've got someone there, it's having that person there saying, yes, it's okay, do that. Yeah.
So it's all kind of scary. Let's move on to the next question. So people worry quite a lot about managing cardiovascular risk factors such as blood pressure and high cholesterol. What would you say to those people that are, you know, is that important in diabetes management?
Yeah. So sign up for an Eden Care Me course or 3 treatment targets. That would be my thing. Just message the Eden email box, and we'll because I think you do need that background information or boost to really make it click in your brain how important blood pressure is and managing cholesterol. The most important thing you can ever do to reduce complications, to slow down progression of anything. We're talking eye disease, kidney disease, everything is affected by blood pressure. We're talking about just preventing heart attack and stroke, and how it's all interconnected. So if you do want to be convinced how important managing blood pressure and lipids is, then I would suggest sign up for either of those courses. But in the meantime, the nice guidelines, new guidelines out last year for blood pressure and lipids are so clear, really good pathways for blood pressure care, easy for diabetes, test standing and sitting, and start on an ACE or an AN or an ARB, don't delay. And those pathways are really clear on the new NICE guidelines if you just print out that care pathway. And lipids as well, brand new guidelines, all printable off, back and front, really easy to follow, mostly 8 atorvastatin 20 for most people. Start as soon as you can, but keep titrating up. And don't, if people are a bit borderline with their blood pressure or their lipids, a little bit, it's 5.1 or 4.8, I'll see what they're like next time. Don't. Just get in there and do something. Blood pressure, the same. If it's like, I don't know, 130 over 86, it's not too bad, it's okay. Just do something. Little changes make a big difference, and even bringing it down by 2 little points on the little thing can actually reduce risk of cardiovascular disease by 30%. It's a massive reduction. Every little counts. Do something, but it's so important. I'd encourage you to come along and hear more, or sign up for something.
Absolutely, we need to steer away from the glucocentric sort of model that is too old now. It's all about cardiovascular disease. Tamsin, I think you've had a couple of questions.
Yeah, so I mean, I know you've kind of touched on it by saying, just sign up, but with people that obviously work in hospitals or in the PCNs, do they, does it have to be sort of like trust signing up in the sense of, getting access to these courses, or does the whole PCN have to access it?
Okay, thanks, Tamsin. Good question. So there's a number of ways you can do it, actually, and probably almost to think of it as a bit of a continuum, where if you're just an individual who is perhaps either, working on your own or not maybe working in diabetes yet, but keen to get into it, we have a range of very short e-learning courses that people can access for sort of like a tiny one-off fee that then gives them access to all of the e-learning modules. I think there's 12 in total for about a year, and they can just contact us by the mailbox and sign up for those. So that's one way that people can do it. Another way is that you can come on virtual programs, and either come on as an individual or come on as a whole group. So generally, we would probably get commissioned by either PCN, an ICS, a group of people who would want to change something, hopefully based on data, rather than I've just got a bit of a wad of cash, can I chuck it at you? Let's spend it fast because it's the end of the year. So hopefully based on either NDA or care processes, or our foot outcome is poor, any of those things. So as soon as someone makes an approach to us, we probably would want to have a conversation and say, what's the need? What's the drive? Try to match their need to our product. So whilst we've got things that are off the shelf, we'll often design from scratch for people based on what their need is. So it might be that there's a range of support workers that want training in annual review. It might be that there's a range of pharmacists who generally want the whole of the cardiovascular spectrum. So for me, it's always been really important, and I guess it's part of that kind of doing your job properly, is that we do a really thorough diagnostic. What is it that people want, and what do they want to be different at the end of it? Otherwise, it's just nice education. you know, a nice education is great, but why spend that unless you're going to see a difference at the end? So it's about understanding what the need is and what people want to see differently. And then there's a number of different ways they can do it. So virtual courses, we've got a whole range of infographics that are free to download from the website. The other thing that two other ways that you can access our training actually is, for many years now, we've done a train the trainer. Fiona said we used to do a lot of Premier Inn traveling around the country. And then we created a train the trainer program, which was basically that a whole area could develop, could get a number of people trained in our resources. So we would provide the resources that we spend all of our time writing, but actually we'd train people in Eden philosophy and the materials, so that actually you then have a license fee and you use those for the 3-year period. So we've probably done that in about 20, 30 places around the country, maybe. So 25 or more people are then trained. And the beauty of that is that you can really create something sustainable in your area. You know, you can train a healthcare professional, you can train a nurse, a pharmacist, a podiatrist, a dietitian, a doctor, a GP, etc. And all of those people can then roll out training, which people think that's the easy bit, but actually that's the really hard bit, getting that administrated and getting bums on seats in training. But once you've done that, you've then got materials that you know you're going to have updated, credible, valid, reliable materials for the next 3 years. And I think the final way that people can, and we talk about this quite a lot on our social media, is we're often supported or in partnership with some of the pharmaceutical companies, which then allows the training to be free of access for people. So we've got into the 2nd year of a programme with Sanofi, which is for staff in care homes and community nurses, absolutely passionate about trying to improve care for diabetes in care homes. Abbott, places like that have worked with us to create technology and modules around Freestyle Libre, Flush Glucose, and again, they're all free as well. So the pharmaceutical companies shifted massively, haven't they, in the last couple of years, in terms of, you know, they can't just sell drugs anymore, particularly in a pandemic. So their switch has been very much to actually creating value at a coalface in terms of education. So we've been lucky to benefit from that. And I think people who want education, and therefore patients, have been lucky enough to benefit from that as well. So hopefully that answers that question.
Yeah, I think we've got some from Facebook now. Vicky,
Yeah, there was, I think you just touched on that, but there's one about, do you have modules on technology? And the answer is yes, we do.
We do, yes, we do. So there's also at Leicester, we run a master's as well, and obviously they have a technology module as well, but we have a short module. It's covered in a lot of our insulin modules anyway, isn't it, Fee? But we have a specific module we worked on with Abbott last year, which is very much around primary care. And we have got some really exciting stuff coming out this year in partnership with a number of different companies, looking at what the NICE guidelines are going to tell us in terms of type 2 diabetes into primary care. So watch this space for that. We're just in extended conversations at the moment, and there'll be something really exciting coming this year that will be free to all.
And then there's a question from somebody who's not employed by the NHS. Can they still access the course? And I guess whilst we're asking that question, maybe just touching upon those non-clinical or support staff as well.
Yeah, first question I'll answer, and then Fee can chip in as well. So you absolutely can, yes. So you can get access, and we've trained people both within the NHS, in private sectors, prisons, secure settings, voluntary sectors. You know, we've done stuff, pro bono work for the voluntary sector, for the charitable sectors. For us, it's about giving back as well as doing, you know. So we work in research, we work in grants, so people can access our training anywhere. If you're an individual and you come and say, I just want to have some basic fundamental training, I'd probably recommend that people start with the e-learning modules, which costs £25 for the whole year. So people can just do that, and they register and log in, pay through PayPal. In terms of support staff, we're massively passionate about this area, aren't we, Finn? I'm sure you'll talk a little bit further in a minute, but you know, these are the guys that are quite often doing a lot of the front coalface work. So we've had modules for healthcare assistants when there was literally just healthcare assistants in practice. But now, through other changes in the long-term plan, you know, we have found that people who are paramedics, physicians associates, nursing associates, physios, all sorts of people, social prescribers, come on our programs and are asking about things. So we genuinely want to stay ahead of the curve and think about what's coming next. So that's something that we've always taken great pride in. Fee will perhaps talk a little bit more about some of the developments we've done in the last couple of years, because I think probably we're really, really proud of some of the work we've done with support staff, aren't we, Fee?
Yeah, we are, I guess. Yeah, so we've developed a kind of nice package. This is a commercial break now, unashamed. Going to sell you Eden Essentials. So we developed this for anyone in that working environment that has anything to do with diabetes, or they're patient facing but not clinical, or they're patient facing but they have a kind of more directional role, not necessarily a clinical input. And then also for anybody who feels more knowledge would help. And we've been really surprised how many people fall into that category. We've done some work recently with receptionists who were so hungry for this extra knowledge about diabetes that it really shocked me how much they wanted it. And they felt like their training needs were overlooked a bit, and everybody else gets training and we don't. And they really felt that more knowledge around diabetes would really help them. I mean, they get asked, they're sent a lot of tasks from doctors saying, can you fit this person in for this, or this person needs this, and they really don't understand what that means or what the urgency or time frame would be, or and they really felt background knowledge would help. So we developed a few resources suitable for all, I guess. And there's an Eden Foundation lesson. It's all part of what we're calling Eden Essentials. It's part of a package, but the first element of it is Eden Foundation, and it's a nice presentation to get anybody started knowing what diabetes is, the different types, what's different about the different types, how you might pick up a diagnosis, and then what comes along with diabetes, what can cause it, what are the risk factors that can build up and cause diabetes, what are the possible things that people with diabetes might get down the line. So it's not put that simply that it will insult anyone's intelligence if they are clinical, but it's a good, exactly what it says, it's a foundation. It's not for experts, it's an introductory level short course. It's less than an hour to watch. We sometimes present it as a live webinar, or we have it as a recorded lesson that we can send out to people. So that's Eden Foundation, and then they get an add-on for the different roles that they have in their job. They'll get a different add-on package. So for the healthcare assistants, they get a healthcare assistant add-on, which is just for them, and it's about the feet checking and the blood pressure checking and the practical issues of what to include in an annual review or in an annual MOT, their part, what blood tests should they be doing and why. And it just gives them that background. Why have I been asked to do all this? And it gives them that background, which we've found really helps them to enjoy their job more, because they now thinking, oh yeah, I know why I'm being asked to do this now. That's in, and they do it with a bit more oomph. So that's for healthcare assistants. For the receptionists, we developed a one-page infographic to help them dealing with phone calls from people with diabetes and what's urgent, what needs sorting out today. And Vicky's helped with this. So, I'm not saying this has all been me by any means. We're a team of amazing people, and we're still pinching ourselves that we've got Vicky on the team, because she's just amazing. So we've got a whole team that are working on all of these things, not just me. So the infographic really was for receptionists. What needs urgent dealing with today, what can needs sorting out now, but it's not urgent for today, but this week sometime. And then all of the things that can wait but still need doing, but they're a routine, book them in, and they absolutely loved it. Well, we trialed it with a couple of practices and their receptionists, and they were like, wow, we wish we'd been told this ages ago. This has really made us relax a bit, really, because they were always a bit, have I done the right thing? Someone's ringing, they're thirsty, they're tired, thinner, and all the lot. I'll book them in to the GP in 2 weeks because that's all we've got. And so it's hopefully to rule out that a little bit and be safer practice, but also give them the reassurance they needed. So there's that, and then there's the Eden Elect body, which we'll probably talk about as a separate thing because it's quite a big thing, but you can see it on our website, Eden Elect, and it's a body where you go around clicking on many different parts of the body. Everything reveals information, initially in 4 bullet points. So if you're in a hurry and somebody's kidney function's a bit off, you can click on the kidney and it gives you the 4 main things that you need to know and you need to do. And then you can click on more information to look at later if you want to. So, but it's got everything in there. It's got blood glucose levels, cholesterol. It's got all lifestyle things around the edge where you can click on physical activity, alcohol, smoking, diet, things like that. But then, you know, that's suitable for everyone, and we're using it as a teaching tool. So if you want to put on a very bespoke diabetes education session for different roles or different occupations, it's completely bespoke to them because they can tell you which bit they want to learn about, and you just go to that and we'll discuss that because that's relevant to them. Whereas, you know, talking for 10 minutes about a liver might not be relevant to receptionists or to social prescribers. But so, yeah, so you can have a look at that on the Eden Diabetes website.
So just a few comments on Facebook. No questions at the moment. Please do add your questions to the comments section on the Facebook post and we'll ask them live, but I'll just read out some praise. So we have Pauline Weir is saying, thank you for putting this on. Great to have this information. I've not heard of Eden before. I'm really looking forward to finding out more. And then Sarah Hudson says, completely agree. There are so many resources, but the challenge is putting it into practice. And then somebody else was asking, so Vera Lynn is asking, how can we contact Eden? And we've replied with the email address, which is eden@uhl-tr.nhs.uk. Is that right? Yeah. So Vicky, was there a question that you had about the QIC Awards, I think?
Yeah. So we were all at the QIC Awards, weren't we, last October?
You were.
So it was just to expand on really. So Eden got highly commended for the programme that was called Complement Plus. And I just wondered if you wanted to share a little bit about what that is and how fantastic it is.
Oh, do we? Yeah. Thank you, Vicky. I'm launching off, Laura. Is that okay? You know, while I'm in the flow. Yeah. So,
Laura's feeling quite poorly, aren't you, Laura?
Yeah. Give her a break. So Complement Plus. I'm just going to tell you a little bit of history. So it had originated as Complement, which stood for Complete Mentoring, and it was a full diabetes program, educational program, originally for clinical pharmacists, because they were kind of an emerging group that we were realizing would be really good at delivering some diabetes care if they were given the right training and support. So we originally developed Complement for pharmacists, and that also won a highly commended at a QIC Awards a couple of years ago. Complement Plus is the evolved form of complement, so it's evolved in many ways over the last couple of years. It's evolved to include all sorts of healthcare professionals. So it is now no longer just for clinical pharmacists. We've made it a version appropriate for practice nurses and GPs and any secondary care clinician as well who's interested in learning more about diabetes. So that's one way it's expanded. The other way is we adapted it to still be able to roll really effectively throughout COVID. And we're glad we did because we didn't really envisage it would go on for this long at the time. But so it can all be delivered virtually. So it's grown, and we now deliver it across the UK and not just local to Leicester. So that's been great geographically to include all kinds of regions, and we've run cohorts from all over the country. And yeah, so it's it does include mentoring, which is the element that we think sets us apart from other diabetes education, and we think that's the really important part. So basically the whole course, if you do it from start to finish, some groups have done it in 4 months, but usually we take 6 months. It's done over a 6-month period. During that time, they'll be sent a total of 4 lessons to watch, which are recorded lessons, 4 e-learning modules to complete, and then they'll have 4 mentoring sessions, and they're all staggered so that they're done kind of every month or 2. And over the course, by the end of it, hopefully they've got a really nice full rounded knowledge of what to include, how to conduct a consultation and a review of your patient, and how to keep progressing with that patient. But you know, be mindful of other things to include, as Amanda said, not just looking at glucose levels. As it was originally developed for pharmacists, we have also got a module in there that's every treatment known to man for treating glucose levels, but also for treating other things as well. And we need mentoring in there as well, because it's just, you can't really, you might as well give someone a BNF and say, here, go and read that otherwise. So that discussion element where people bring their case studies, they discuss their difficult cases or anything they've come across. We do it in a big, well, not a big group. We probably try and stick to between 10 and 20 people, just so that everyone can have a chance to talk or you know, at least listen to other people's cases. But that we find people are saying, and their feedback is really valuable, because you get other people's opinions. As you know, like if we were presented with a patient now, the 4 of us or all of us would have maybe a different way of dealing with that. There's more than one way to get to Skegness, is a Leicester saying. So you know, that discussion element of cases is really useful. And what would you do? And you know, Vicky's done a few of these with me, and you know, I
really enjoy them. I think it's definitely worthwhile. It's almost like having someone sitting with you, isn't it, in your clinical room?
Yeah.
When you've had a tricky patient that you maybe need to run something past somebody. But I really enjoy the mentoring sessions. I think it's really good.
I think one of the things as well, sorry, you go for it.
No, sorry. Even if you're just saying, yeah, that's right, you know, you can do it that way, or you could do it this way, you know, or you could see what your patient says, and you know, all of that discussion is really valuable, isn't it, Vicky?
Yeah, definitely.
We do it in our WhatsApp group. You know, whenever one of us has got a difficult you know, scenario, we're kind of like, what would you do? And it really does help to have that peer support, doesn't it?
It does, because you know, we like to think we're experts, but there's things you just forget, aren't there? You might just,
and like you said earlier, diabetes is always changing. There's always something new. There's always new evidence, and you know, it's hard to keep up with it all.
Yeah, and there's never just one answer. I think, you know, we always find that, you know, you see one patient and then somebody else sees them the next day and they're like, oh, why did you do that? It worked, but why did you do it? You know, and I think, you know, you always have, I think, you have your favoured treatments, don't you? People always go for one insulin over another insulin just because they're used to that insulin. It's not necessarily the right answer, but it you know, it's just because they know how that one works and they're much more confident in you know, that medication. So sometimes it's always worthwhile coming back and saying, you know, I did this, what do you know, would you have done that? What do you think?
And that's the great thing about having a team that is so experienced. I mean, Vicky became a DSN when she was 12. I think she's got like 16 years of DSN experience. I don't know how, but you know, we've all tried things and seen what happens when this, you know, or we've experienced so much between us all. And it's good to pass on some of those stories, isn't it? To people, you know, you kind of forget that some of these people on the course are very new to everything, and it's all, you know, you can spend 20 minutes talking about metformin with a group where you think, oh, everybody knows this, surely, because you know it and you've done it for so long. You know, it's you do need to be very nurturing and start with the basics with some people, and just that's their opportunity to say, actually, I still need help with metformin and titrating it, and should I just stick with 1, or should I go up to 4 if their HbA1c is okay, or, you know, all of these things. That's a really valuable part of it.
Can I just add in quickly about outcomes as well, actually, Amanda, because we know that you know, education is great. We all think it's vital, but actually, as commissioners, people will want to know what comes at the end, won't they? And I think most people will probably know that education is really hard to prove. It changes how you feel, it changes how you practice, but actually, does that translate into hard stuff? And that's something that keeps me awake quite often at night over the years, thinking about. Sad that I am. And I think there's a number of ways, really. And one of the things with our original Complement Plus pilot was that there was some really significant patient outcome improvements in the first cohorts of pharmacists that we did. So all of the 3 treatment targets in the 30 or so, I think it was, I can't remember, patients that the pharmacists saw over 6 months improved quite dramatically in terms of their data. And that's really good, because one of the things that always puzzles me is that we know that people feel better after education, but does that make them a better practitioner? And if you go to see your GP or your nurse or your pharmacist, do you know that the one you see because they've had education makes them better at treating you? Of course you don't. But actually that's one of the things. And I think the other way that we try to measure outcomes is with something called our knowledge and confidence. And we won an HSJ award for this actually back in 2016, which was about how very much this self-reported knowledge and confidence that people complete both before and after a course can be used to measure their outcomes as well. So, you know, some people will overrate themselves, some people will underrate themselves. That's fairly typical. But what it does is it gives us a comparison between cohorts and groups of people. But if everybody starts in the red and say that they're not confident in a particular area, we would then look to shift that to either amber or green in terms of a 5-point rating scale that we use. So there's some of the ways that we try to prove efficacy, if you like, so that those people that are perhaps saying, how do I get a return on my investment here? You know, we want to invest in our staff, but how will we know things are different? There's some of the ways that we use to try to measure that. And I think that's really important as well, isn't it? Because otherwise, again, it is that nice to do that we all love, but how do you do something that stands out that actually very often commissioners rightly say will be outcome focused?
Yeah, it's a good point. I mean, you know, the original question was about the QIC award. If any of you have entered one, some of them, their tedious process of filling in, aren't they? And you do have to prove outcomes. You have to have good, solid evidence that what you have done has made a difference and been effective. And, you know, as Laura says, that's difficult with education. But when you've got the evidence that we were able to collect for both the awards, you can't argue with that this has made a difference and it has been effective, and we've got figures to prove it as best we could, and when it ends up in benefit to the patient, then you can't argue with that. But, you know, also
Absolutely.
Yeah,
sometimes people talk about the pounds, don't they? And I think one of the areas where we will see a difference is in the 2-year care home project that we're working on with Sanofi. So
there's actually a question about that.
Okay, go on, you ask the question and I'll see if I was going to answer it.
The question was, please could you tell us more about training for non-registered practitioners looking after people with diabetes in care homes?
Okay, yeah, let's do so. So we've been looking at care homes for a number of years, really, and aware that both across our patch in Leicestershire, that there was a real need to educate people. And we had a brilliant course that we had designed, a face-to-face course that was about to go live in April 2019, that had 55 people booked on it. And 2 days before we went into lockdown. So we spent the next sort of 4 or 5 months after that changing it to a virtual course, which, if you can imagine, your typical kind of care home population does bring challenge, both with health literacy, economics, the amount of training that people have access to. So it's a real big thing. So when Sanofi came to talk to us and said that they wanted to use some of their conference money in lockdown into a piece that they hoped would change population health, we were really excited. So they were very interested, and we'd done a lot of research looking at how education could improve care homes. We've kind of looked at the data across our patch and nationally, looking at a lot of Alan Sinclair's work around sort of admissions based on hypo scores. You know, I think there was 89% of care homes in one of the pieces that we looked at didn't have a hypo box, you know, just at the very basics. So James in our team led on this with Sarah Gregory, actually, who some of you will know. And what we have ended up with is a program.
Sarah's watching. Hi, Sarah.
Oh, is she? Hi, Sarah. What we have ended up with is a program that is virtual, that is really brief. We hope to complete. We've tried to hone it because we recognise that whether you're a nurse or an unregistered carer in a care home, you get very, very little time for education. They probably get 2 half days in a year, do you know what I mean, on top of their mandatory training. So we've honed it with, but kept the best principles, I think, of our service. So it still has a mentoring, it still has an e-learning, it still has case study and support, but it is very much based on the whole spectrum of actually what is diabetes through to how to deal with end of life, to frailty, to all of the things that people in care homes are more vulnerable to. And with Sanofi on board, what we've been able to do is reach out nationally. So I think in the first year we've had we started in May last year, so we've just done our May to December data. So we've had 900 people register, 480 I think start, slightly less than that complete, because obviously that brings challenges in a pandemic as well. But some of the outcomes that we're seeing are huge in terms of just that hypo box thing I talked about, people saying that they're now doing foot checks, people saying that they've now got confidence to be the kind of lead or the trainer for diabetes, the link nurse, if you like, for want of a better word. So we're starting to collect that data. We're moving into year 2. And I think, I can't remember the exact pounds on it, but if you transfer the one hospital admission that is either prevented or reduced into kind of days in hospital, typically 8 days stay, I think is what the data tells us from the IDOC report for these people, but actually you're talking about 1,000 something, I think, per stay per person, which if you then transfer that into a national piece, what that could achieve is absolutely phenomenal in terms of hundreds of thousands of pounds of saving and appropriate care going to the right place. So we're really lucky. So you can access that, but again, via the Eden website. Sanofi have a whole range of material on it. If people don't want to work with a pharma company, because some don't, you know, or their CCG doesn't allow that, then we run that through Eden as well. But obviously, if it runs through Sanofi, then actually everybody gets access to that free of charge as well. So, and what we're finding is really beneficial, Amanda, is that if a group of people from the same home or the same group of homes completes that together, that's really advantageous, because you know as well as we did that the movement within staff in those sectors is quite high as well in terms of turnover, absence, etc. So they're a really tough group to crack, but we're hoping that by tweaking the programme into year 2 as well, we'll be able to do a really big piece that's valuable.
James has just added the link in the comments to the CARES programme on Facebook for anyone who wants to have a look.
Good man.
I think Tamsin's got a question on Facebook.
Yeah, so we've had a question from Facebook. I mean, we know that nurses find it hard to get money for study from trusts and things like that. So, you know, it's about the cost of the courses. And obviously you've said there's some free modules on there that they, you know, that they can access. But generally, you know, what is the sort of cost, you know, of the courses that maybe they would want to do?
I think it's really hard to say. I've talked about the sort of price for the e-learning modules, isn't it? And then there's a number of other things that are free, and we've definitely tried to shift our model in the last 3 years to more courses that are pharmaceutical or commercially supported, which means that they can be offered free to people. So I think the best thing to do, because we do very much base everything we do on need, would be to make contact with us, tell us what it is that you need, and then we'll have that conversation. And you know, and if an individual comes in, we'll quite often say to people, well, you want to go back and see if there's a greater need within your area that can then be supported, or how can we support you either as an individual or as a group of people as well. So, you know, economies of scale, the more people that get educated, the better care that patients get.
So it should not be sort of how much does it cost, but how much can you save by reducing errors,
absolutely. It is
providing better care for those patients and reducing hospital admissions.
You know, and many areas do think like that. I'm trying to think, I couldn't possibly say off the top of my head, but we've probably worked with 40, 50, if not more, sort of CCG. So we're not as huge as some of the other training and education companies that just do e-learning, you know, who might have 300 CCGs or something on their books. But I think what we do is do this bespoke piece where we'll say, well, what do you need? What do you want to see different at the end of it? So we've got the most phenomenal foot care specialist nurse that works with us, who was the year before Vicky Healthcare Profession of the Year, Rachel Berrington. So we know that foot care is massive at the moment, and there's money being pumped into CCGs to spend on foot care backlog based on the NDA data, based on the numbers that are not getting referred in a timely fashion, you know, all of that. So for us, it's about, well, where does that compass then point? You know, how do we measure the barometer of what's out there and think, well, what can we offer for that in terms of foot checks? And that's really hard to do virtually, isn't it, as well, because some of that competence and confidence comes with handling as well. So we're trying to think about how we can support the nation with that foot care work as well, which is really needed.
I think, there's going to be a lot of issues, I think, coming up with feet in the future, where people have missed their foot checks during the pandemic. That's quite a scary thing. But well, there are no other questions on Facebook, so I think we've probably took up enough of your time this morning. Thank you so much for coming, guys. It was really, really, really helpful. And I think a lot of people are going to come. Your website's going to go whoosh now, where everyone tries to book on a course. So unless there's any other questions from any of the team, I think we'll all say goodbye.
Thank you both, and I'll
Thank
see
you
you
for
on
inviting us.
Monday.
You guys are doing such a brilliant job, so glad to be part of it. Thank you.
Get well soon, Laura.
Yeah, get well soon.
Thanks so much for inviting us.
That's okay, anytime.
Thank you.
Bye.